circling. Okay, and we are live. Good afternoon, everyone. I'm going to give a few minutes for people to join in. We'll just give a couple minutes for people who are joining in late to join in. Then we'll start with our introductions and it'll give more time for people to join us. We're just waiting for a minute or so more for people who are just about finishing their work and trying to log in. Okay, I think we can get started. And for those of you who couldn't make it to the live session, the recording is available, so you can watch that later. I'm going to start with our introductions. I am Dr. Malathi Acharya. I'm an integrative medicine expert. I am the founder of my practice, Ayur Integrative Medicine. I help healthy people achieve their health goals and age with vitality. And I also help people with chronic illnesses take back control of their lives and give them the hope that they can lead a life that is full and satisfying. And I have the privilege of having Dr. Nishi Bhopal here with me, and I'm going to turn it over to her to introduce herself.
Great. Well, thanks, Dr. Malathi. Thanks for having me here today. So I'm Dr. Nishi Bhopal. I'm the founder of Pacific Integrative Psychiatry. I myself am an integrative psychiatrist and sleep specialist. And at Pacific Integrative Psychiatry, we serve patients all across California. We're an online telehealth practice offering a holistic approach to optimizing mental health so that people can live their lives and achieve their full potential. And we really integrate conventional psychiatric approaches like medication management and talk therapy with nutrition, with mind-body practices. All of our practitioners are trained in integrative medicine, so we can get, help people with a full body approach to mental health. And then I also have a YouTube channel under IntraBalance, which is all about sleep medicine and teaching therapists and physicians what they didn't learn in medical training about clinical sleep medicine.
Wow, that's wonderful. Thank you, Dr. Bhopal, for that. I also want to mention one thing. What we are talking about and discussing here is just for knowledge and information purposes. This is not to be construed as medical advice. So if you have any specific questions about your medical advice, the best resource for you to reach out would be your treating physicians. And our topic for today is about burnout. And, we are going to talk about navigating burnout, stress, and the accompanying stress and anxiety, and what we can do to tackle that. I'm going to briefly start with what is burnout. Burnout is a state of emotional, mental, and physical exhaustion, and burnout can happen because of a prolonged and excessive stress. So we often experience stress, and the stress response is essential for us to function well and also to get away from danger. But if the stress is continued and prolonged, that leads to burnout. And commonly people describe things as they feel overwhelmed, they feel drained, they feel exhausted, and I have no emotions. Those are what people describe what they're feeling with. And it feels like I'm just acting as a machine. I feel like I'm on automation. I have no feelings. I don't have any involvement in what I'm doing, whether it's at work or it's at home. And also a lack of sense of achievement. What have I done so far? What have I achieved in my professional life or personal life? Or that, oh my God, I haven't done anything significant or worthwhile so far, which is not true. All of us have a meaning and purpose, and we are doing that and living that. But that, in times of burnout, that's what we feel. And the key thing is that the burnout can happen not just from work stress, but work stress is one of the most common causes, but it can also happen from stress at home, or relationship stresses, societal pressures. It can happen from just excessive responsibilities and work at home with no help, or caring for a sick person, or in any situation like that. So it's important for us to understand that this is happens in different situations. Dr. Bhopal, do you have anything else to add?
Yeah, I think that's such a great explanation of burnout. And what you said about stress is really important, is that stress is a normal response, right? And so all stress isn't bad. In fact, when we're experiencing stress, sometimes it's because our nervous system is doing what it's supposed to do. So because I think stress has kind of gotten a bad rap in,
Mhm. Yep.
modern parlance. But in fact, a little bit of stress can actually be motivating. It can help us feel excited about things. And this is known as eustress, EU stress. And we might experience that like when you're giving a talk, a webinar,
Yeah.
or if you've started a new job, or you're competing in a game or something like this. But it becomes problematic when your nervous system is kind of stuck in that stress state, and that can lead to burnout. And I think you explained that really well.
And how common is burnout? We are hearing it everywhere, so it is very common and prevalent now. um, and the actual numbers depend on the profession, depend on the country. So in this country, the data shows us that it's very, very common among healthcare professionals, especially compounded with by COVID. Teachers, teachers, first responders, and people in corporate sector. Burnout is prevalent in them, amongst them also. Of course, there is a difference by country. Um, there are definite data shows us that definite gender differences. Women are more prevalent in women because of their role and their responsibility, both at work and at home. And of course, we all know that the COVID pandemic has worsened it. Dr. Bhopal.
Yeah, and I'll just add some statistics to that as well. So people who are experiencing burnout are 23% more likely to visit the emergency room. They're
Yeah.
63% more likely to take a sick day from work. And then more than 2.5 times as likely to leave their employer. And as you said, burnout it affects every aspect of life. So it can reduce a person's professional efficacy, but as you mentioned, it also can impact their relationships and their own physical health as well.
Absolutely. The statistics, that the numbers that Dr. Bhopal mentioned are very important, because burnout has consequences. And that's why we feel it's important for us to come together to talk about this. Now, I want to reiterate one thing. Um, we all know that the blame for burnout has been ascribed to the person, and often characterized as their lack of resilience, or their inefficiency, or that they are not able to cope up with the stress. And we all know that that is not true. That is not true. However, um, Dr. Bhopal mentioned the consequences of burnout. They're the physical, 63%, I think you said 63% most likely chance that you will go to the emergency room. Those are significant. That means that you're having a significant health problem, right? No one goes to an emergency room unless they have a health related problem, medical problem. So it has the blame and responsibilities part is not true, but what is true is that the consequences are often borne by the individual. So we just want to, and you have the power to to heal yourself, to heal your body, mind, and soul, so that this doesn't progress to a point where your health takes a big hit. And that is what Dr. Bhopal and I are here to discuss, that you have the power, and we want to talk about a few skills and few things, simple things that you can do to heal your body and come out of this. Do you have anything else to add on that point, Dr. Bhopal?
Yeah, it's it's an important point that it's not the fault of the individual. It doesn't mean you're not doing enough yoga or something, right? That's leading
Yeah.
to your burnout. And I think it's so interesting when we think about the demands of modern life. because we live in a time period where our lives are more comfortable than ever, right? We have food, we have water, we have shelter, everything we need is available to us. It's at our fingertips. Yet we're seeing such high rates of burnout and stress and anxiety, which are all related, but they're kind of different things as well. But we're seeing these levels skyrocket. And as you mentioned, during the pandemic, these numbers just exploded. And there's a lot more attention now being paid to mental health and these things as well. But, thinking about some of these causes of burnout, I kind of think about it in three categories. So one category, I think, is just our daily lives are so busy, right? We're constantly bombarded by stimuli. We have these little machines that are in our hands all the time, right? Our phones. So we're constantly being bombarded by social media, by news, text messages, emails. There's this pressure of feeling like you have to respond to people right away. So that takes a toll on your nervous system. So we're constantly connected. There's so much to do, even looking at kids, right? They're so overscheduled, and then parents are driving them all around all over the place. Like, our schedules are just jam-packed, and so it leaves not enough time for nourishing practices like getting enough sleep. That's often the first thing that is thrown out the window when people are very busy. Lack of time to prepare nourishing meals and food, lack of time for exercise. So all of these things we'll talk about. So daily life, I think of as one category. Then you mentioned sort of these bigger social constructs, and I think of that in terms of the economy, inflation. We're both here in the Bay Area. There's been tons of layoffs. People are having a hard time finding jobs, and that's no fault of their own, right? But that can lead to burnout, stress, and anxiety. There's a lot of pressure to perform. People with social media, we're constantly comparing ourselves to others. And you've got these like 40 under 40 lists, 30 under 30 lists. So people have this pressure to perform that I think maybe wasn't there in years past as intensely. And then I also think about the environment, light pollution. We have a darkness deficiency at night, and then a light deficiency during the day, noise pollution, air pollution, climate change, and all these other bigger issues as well. So I think we're contending with things on so many different levels.
Great point. Great points, Dr. Bhopal. So, when we think of what is the cause and why is it so prevalent, whereas our previous generation did experiences, these are all the things that come to mind, and you put it together so well. Moving on to, there's some foundational things that we can do to help start the process of healing and coming back into health. And Dr. Bhopal, I'm going to turn over to you so that you can to have starting on that, and we'll both chime in after that.
Sure. So I think of foundational healing practices in terms of micro practices and macro practices. And I can explain what that means. So with the macro practices, these are things like sleep is a big one. Nutrition is a big one. Exercise is a big one. And then feeling connected and having a sense of purpose. So I think of those as like our bigger foundational practices. And then micro practices, I think of in terms of like small little things that you can do every single day during your day that don't take a lot of time. You don't have to go anywhere. You can do it exactly where you are in the moment, and it can help to regulate your nervous system. So that's kind of the two big categories that I think of. So in the category of the macro practices, sleep, of course, is a big one. And as I mentioned, that's often the first thing that goes out the window when we're really busy. And I mean, I have the sleep talk with my patients every day who are struggling with stress and anxiety. Because if we're not getting enough restorative sleep, our brains are actually not going to function as well, right? You're going to have higher levels of irritability. Actually, studies show that there's a bidirectional relationship between anxiety and sleep. So if you're getting insufficient sleep or poor quality sleep, it actually increases your risk of developing anxiety. And when people have anxiety, they have a harder time with sleep. And so that becomes a vicious cycle. So it's really important to think about not only getting enough sleep, but also looking at sleep quality.
Absolutely. And, the circadian rhythm, right? Waking up with light and going to bed with darkness is so important. It even has an effect on our gut microbiomes, the bacteria that live in our intestines. And these bacteria actually are in the nervous system in the brain and the nervous system in the gut are constantly talking to each other. And when our sleep is affected, the type of bacteria changes and the communication channels start transmitting different type of messages that work against us. So sleep is very vital. um, the other form, macro practice is nutrition. um, you know Sometimes we may think that when we are in a more stressful and busy situation like what we are in modern life, I think we compromise on our eating. Often there is no time to eat. And also we compromise on what we eat. So at the level of each cell in our body to function, we need nutrition. So taking the time to sit down and eat, give yourself, don't miss me not missing meals, and sitting down and having our meal, that is the time. I feel it's also the way I think of it as a self-care time. So I'm nourishing my own body, so that is self-care. All of these self-care practices kind of tune up, activate a system of neurons called mirror neurons that actually fill our compassion cup back. One of the things we talked about is a lack of emotions, right? We don't feel, something may be going on with our best friend or family member, and but we feel like, oh my god, I don't even have the time to think with it or deal with it. Lack of compassion. We run out of compassion, which is you know very normal. But the self-care practice, so making sure you eat a good nutritious meal, making sure the meal has proper carbohydrates, proteins, healthy fats, a mix of seasonal vegetables in all the color range to catch all you know the micronutrients that they carry that are very important for us, for our physical and mental health. It's also very well known that eating processed and refined foods, like a diet that is heavy on refined sugar, or eating really ready-made processed food, just opening the box and eating such meals, we know it affects our mood and makes anxiety and depression worse. So, as much as it's practically possible to include healthy components in our meals and eating meals regularly, that's very important. So the getting us back on a healing path always starts with nutrition. um Go ahead.
Oh, I was just going to say, I love how you framed nutrition as a form of self-care, and just taking that time to really nourish yourself, because so many of us are eating on the go. People are eating at their computer while they're checking their email, they're eating in the car, they're standing up, they're not even sitting down and eating. So I love how you kind of framed that. And I'm curious how you recommend to your patients who are feeling overwhelmed, they're really busy, and they say, I don't have time to cook. I barely even have time to go to the grocery store to buy food. So how do you recommend people bring in sort of these new nourishing practices and nutritious food when they're already feeling overwhelmed?
Okay, I think we are
Oh,
back. We had a little bit of a glitch. Yeah. um the important thing is to sit with every patient and explore their lives, understand what their lives daily life is like. What, how is their typical day, and what they can do and what they can't do. And affordability is also an important thing. So what I sit it I sit over and look, go over all of those things and plan a meal. And different people's culinary preferences are also different, so it is highly individualized. Yes, there's no shortcut to getting these things in. If you're not able to cook at home, buying food that are healthier in the ready to eat, in the ready to eat section, foods that are more healthier, like a box of salad with proteins in it, those are what I would focus on, a vegetable, box of vegetables, salad vegetables with good healthy protein in it, or fresh fruits, or, it's important to go over what do you actually do, what is your meal like, and kind of go over each component and make healthy substitutions. That would be the place where I usually start. Tell me what your meals look like, and let's start from there. What quick substitutions can we make to switch that from not healthy to healthy, and kind of build on that gradually?
Great. That's a great approach, because it doesn't require somebody to completely overhaul their life, because that,
That is
that can
tough.
be overwhelming. Yes.
And it's not something we can print and give and say, hey, follow this, because that doesn't work. So it starts with, hey, what's your day looking like, and what do you usually eat? Let's start there. The next thing is exercise, or movement. I like to call it movement, because exercise is, oh, I need to join a gym, get a gym membership, and go there 3 days a week, and the commute to the gym is 20 minutes. No, I like to call it as movement. Um, Movement is very, very important. Of course, all of us know how it's necessary. Burning calories and blah blah, but movement, the deeper aspect, there are two things about movement that I want to stress on. One is that when we exercise, our body naturally makes these chemicals called endorphins, that are natural mood elevators. That kick that we feel after a brisk walk, that is real. There are chemical changes in our body that's causing that kick. That feeling of elevated mood, that feeling that you feel good feeling after a brisk walk. So why can't we tap into our body's mood lifting chemicals that we make naturally, right? So that is one important thing. And in ancient systems of medicine, like traditional Chinese medicine or Ayurveda, movement moves the energy through the energy channels in our body. So, there is a concept that, our body energy moves in our body. And when the energy gets stuck, when the movement of that energy gets stuck, diseases, imbalances, and ultimately diseases happen. So, movement, any sort of movement, will keep the energy flowing in the energy channels, without, leading to imbalances or illness. So those are two important things that we need to move. And exercise or movement should be what you like, what gives you pleasure. It can be walking, it can be dancing. You choose the activity. So so that's important.
Yeah, that's a great reframe as well, because like you said, when people think of exercise, oftentimes they're thinking of, yeah, okay, I need to go drive to the gym and do this really vigorous workout, and then we're sedentary for the rest of the day, right? And it's just not as effective. And we can, like you said, we can tap into those mood boosting effects, also the brain enhancing effects. When we get movement and exercise, it increases BDNF, which is kind of like a fertilizer in the brain, which is important for mood and thinking, cognition, memory, and all of these kinds of things. And yeah, and I think it's important because a lot of us are sitting at our desks all day working. That's what my work day looks like. I'm sitting just like this at my desk at a computer, and before you know it, hours can go by. So really building in intentional movement, and this is how I kind of think about the micro practices, which we can talk about in a moment, but bringing in intentional movement into your day, so that you're not sedentary the whole day and then just getting one vigorous workout, and actually like using your body is actually going to help you even focus better during your workday as well.
And the other important aspect is stress management. So, all of these impulses, all of these things that happen around us that we don't have control of, they trigger the stress reaction in our body. And we all know that when we say stress reaction, it's the sympathetic nervous system that gets stimulated. There is cortisol, there's all the other hormones, and it's one of activation, right? So it's one where the heart rate goes up, the blood pressure goes up, the muscles are all tensed and ready to act. Sympathetic system slows down our digestion, because the focus has to be on escape, running away, or evading the stress. So digestion stops. So this this reaction is in modern day, in modern life, this reaction is pretty much happening, the whole 12 or 13 hours or whatever time that it is, the 18 hours that we are awake, these are happening. And the stimulus for these triggering these responses doesn't have to be big. They're even small stimuli, and inadvertently, without us realizing, the system is revved up. So we have to consciously pause, figure out ways where we make a remote control that kind of pauses on this stress responses. And we have to activate the counterbalancing system, the parasympathetic system, which does the opposite. So calms down, that lowers the blood pressure, lowers the heart rate, loosens up the muscles, lets the muscles relax, and lets our digestive system actually do the function it's meant to do, which is digesting and absorbing the food and nutrition. So if we are not aware of this, and the good thing is that there are simple practice skills and practices that are easy to learn and can be put into practice, that will will help us pull our body from that sympathetic overdrive or stress reaction and put it in the resting or the parasympathetic or a relaxed state. And some of the most simple habits are breathing, breath work, taking a deep breath, activating the vagus nerve, pausing and taking a breather. So breathing exercise, and you can choose whichever type of breathing breath work that resonates with you, that you like, that you feel is easy to do. And they all do the same thing. So it doesn't matter what you do. And not getting overwhelmed with introducing it in your lives in small quantities. So it's 2 minutes of breath work, you know, maybe in a busy morning, or, slowly start slow and build slow. Don't expect, we don't need to expect miracles and start, expect ourselves, push ourselves to do the breathing exercise X many times a day. Start slow and build slow at your pace, at whatever works for you. The thing is, as our brain notices the change and shift, it we are more, our body will more, remember this more and seek it out more. So it's just introducing the habit and building on it. Meditation practices, you know same thing. They help our minds calm down. In fact, meditation helps us, enhances the communication between the emotional and the executive center. So rather than them being dysfunctional and us being impulsive about it, it enhances the communication and helps us make good decisions. So, and again, there are wide variety of meditation practices, and I like that there are so many, because then you can choose what you like. What you can, what resonates the most with you. Yoga, Tai Chi, they incorporate movement and mindfulness, double benefit. Dr. Bhopal, do you have anything to add on this?
Sure. Yeah. So just to expand too on the sympathetic and parasympathetic nervous system, like you were saying, so the sympathetic nervous system is also known as like the fight, flight, and freeze response. And then the parasympathetic is our rest and digest. And as you said, the activating the parasympathetic nervous system is really important for digestion, for for us to be able to digest the food that we're eating and to absorb all the nutrients and so forth. And it's also really important for sleep, because we need to be in a parasympathetic state to fall asleep. And what I see frequently with patients in our practice is that they're in their sympathetic mode. And it's not that the sympathetic nervous system is bad or anything like that. We need both to be functioning optimally. But many people, what I see happen is that they're in the sympathetic activation all day, and then they want to just turn it off like a switch. And now I'm going to fall asleep. And it just doesn't work that way. We do need to allow that time to shift into the parasympathetic nervous system in order to fall asleep. And incorporating some of these practices, as you've mentioned, yoga, breathwork, mindfulness, meditation, and so forth, is going to help train our nervous system to be in that parasympathetic mode. And this is where, I'll talk about micro practices that can be helpful for this. So what is a micro practice? It's something that's quick, easy, and effective. You can do it wherever you are. You don't need special equipment. You don't need extra time to do it. And there's different ones that I recommend. So you mentioned breathing. And as you said, it doesn't really matter which breathwork practice you do. It just matters that it works for you, it resonates with you, and it's something that you will do. So an example is what I tell people to do is after every meeting. So like for me, I'm on Zoom meetings most of the day. Something you can do is after every meeting, get up from your chair, just stand up. You can stretch your arms over your head, or maybe do a couple of squats, or just walk in place for a few steps, and then take a deep breath with focusing on a longer exhalation than the inhalation, or do a 4-7-8 breath practice or a box breathing practice. And we can talk more about that if people are interested in that. But and that's it. And that just takes like 2 seconds. And you can do that in between meetings and then continue with the rest of your day. And if you do that like every hour and a half or so, that's actually pretty good. Like you've gotten some good movement and some good breath work in your day. Another one that I really like in terms of mindfulness and self-care is the hand-to-heart self-compassion practice. And this one works really nicely. Like if people are feeling like really stressed out and you're feeling overwhelmed and tense, this can be really soothing. And essentially what you do is you put your hands on your heart. I don't know if you can see it, but you kind of put your hands on your heart like that. And you can breathe into it. And you can stop there if you want. Just simply doing that can be quite relaxing. Or people can add on just some self-talk to it, just acknowledging how I'm feeling. This is a moment of stress. Everybody feels stressed out. Sometimes this too shall pass. That kind of thing. And you want to say what resonates with you. But these simple little things done throughout the day can add up to having a big impact on how you feel.
Yeah, and the heart-centered, the heart, hand-to-heart touch. So what in terms of energy medicine, it actually putting the hand on the heart activates the heart center. The heart center, and in other traditional systems, it's the heart chakra, and the heart chakra is a communal chakra. So it kind of links us to the community around us. And that's why the feelings that as Dr. Bhopal mentioned, the reiterations are more compassion, loving, kindness. That's what always goes with the heart, and these are the communal feelings. So there's a lot of significance behind these things. But even if you don't know that, just putting the hand on the heart allows us to focus on the heart. And you know naturally, when you start focusing on the heart, pictures of people who we love, and they start coming in our mind, and that calms us down. So it's powerful. Dr. Bhopal, I want I want you to talk to us a little bit about trauma. What is big T and what is little t?
Yeah, so I think trauma is an important one to talk about in the context of burnout, stress, and anxiety. And our understanding of trauma is evolving and changing. So, even 40, 50 years ago, there was a very different definition of what trauma is. So if we think of in terms of big T and little t trauma, so big T trauma describes kind of acute events. And traditionally, the understanding is that these are events where your safety is threatened, like your bodily integrity is threatened. So we can think of this in terms of things like the earthquake that just happened in Morocco. That's a big trauma. Or if you were in a car accident or something like this, those would be considered big T traumas. And typically they're easy to identify. And I think this is important because in our practice, when we're working with people who have anxiety or stress, we will explore trauma as a part of their whole overall experience. We like to look at things holistically. And oftentimes, when we open up this conversation, people will initially say, oh, no, I haven't had any trauma. Maybe they didn't have life-threatening experiences like those. But there's another form of trauma, which is sort of known as little t trauma. And these are more like chronic, ongoing, sometimes more subtle types of experiences that people have had. So they may not have been physically life-threatening to them, but they have impacted the person in certain ways. And an important caveat I'll just point out is that what's traumatic to one person may not be traumatic to another. So you can have, siblings who grew up in the same family, same parents, but they could have had vastly different experiences. right? So for one person, something could have been traumatic, and for the other, it may not have affected them that way. So it's really about how the person responds to that experience. Why this is important. So it's examples of little t trauma are things like being bullied, emotional abuse, even financial issues, stressors, those kinds of things. Neglect as well, emotional neglect even, can be examples of little t trauma. And why it's important to recognize these is that, one, it's, of course, it's going to impact you emotionally. It's going to impact how a person interacts with others, their relationships, how they see themselves in the world. But there's also physical implications as well. And this ties to this idea of adverse childhood events, or ACEs. And the California Surgeon General has been speaking a lot about ACEs and how it's actually a public health issue. And when people have experienced these kinds of traumas, which include some of the things that I mentioned, they're shown to have higher rates later in life of depression, anxiety, but also physical issues like asthma, cancer, diabetes, other metabolic issues, obesity, overweight, and then engaging in risky behaviors like substance abuse, smoking, and so forth. So this is a big topic. I'll just take a pause there, but just to really encourage people to maybe start thinking about trauma in a slightly different way.
Right. Trauma are not just those big events, and they can be little things where that are bothering us, internalized and bothering us. And thank you for shedding light on this important concept, because it's something that is hard to understand, and when we don't know about it, we can't we cannot recognize it or seek help if we have been affected by it. So that's key. And as you rightly pointed out, they just don't have consequences on emotional or mental health, but they have big consequences on physical health. And one more evidence that we are one whole unit. We cannot separate the mind, body, spirit, and emotion. So it's all, what happens in one affects the other. Dr. Bhopal, can you talk to us a little bit about communication and boundaries?
Sure. So yeah, I think this kind of expands on the concept of the little t traumas. Not always, but sometimes when people have experienced those kinds of things, they struggle with effective communication or effectively setting boundaries in their lives because it wasn't safe to do so maybe when they were growing up. Or there may be other reasons that they struggle with these things as well. It's not always related to trauma. Okay, so why this is important to think about is that when we are not taking care of our emotional health, when we're not honoring who we are, and we fall into patterns of people pleasing, trying to please everyone around us, saying yes when we really mean no, or vice versa, or even falling into patterns of codependency, which is when our emotional state is dependent on how others around us are feeling. When your partner's happy, you're happy. When your partner's sad, you're sad, right? And we kind of can lose touch with ourselves, and we can also start to suppress emotions. And again, suppressing our own emotions, not honoring them, can lead to those downstream effects that we just talked about. So anxiety, depression, burnout, but stress, inflammation, cardiac disease, heart, hypertension, and so forth. So again, there's real physical consequences. So what I encourage people to do is start thinking about this in terms of self-care, as we've been talking about, and first identify what are your non-negotiables in your life. So what I mean by that is sleep is one for me, right? Of course, there's going to be times where, maybe you're traveling or there's an event and you're not able to get as much sleep that night. That's fine. We're not talking about perfection, but on average, what are your non-negotiables? Is it getting enough sleep? Is it nourishing your body with good food? Is it getting enough exercise and making time for those things? And maybe saying no to taking on that extra task or project. Again, this is a big topic and there's lots of different ways to approach it. And if people are really struggling with it, working with a therapist can help. And so this is something that we help people with in our practice. And then slowly learning how to speak up for your needs and working through those people-pleasing patterns. It can be very, very challenging. And people around you can start reacting to it in maybe ways that are uncomfortable. But I think it's really important, especially for women. And, I think for those of us who grew up in Asian or South Asian families, boundaries and communication aren't always valued, or there can be a lot of pushback. So I think working through some of this stuff is really important, but it can be really hard.
Absolutely. Absolutely. And can you tell us a little bit about, when to seek professional help, medications, and your role as an integrative psychiatrist?
Yeah, so a lot of the stuff we've been talking about are lifestyle interventions that people can implement themselves, and they can start working on these things. But when people are doing these things and they feel like it's an uphill battle, it's not really helping, or the symptoms of anxiety, stress, burnout are interfering with their daily lives, that's when it's a good idea to talk to a professional. Now, having said that, you don't have to wait until you're in dire straits to go see a doctor. Prevention is more effective, right? That's what we're going for, is really preventing, stress from turning into an anxiety disorder, turning into, some other subtype of anxiety. So a few reasons to speak to somebody is, one is if you're working on prevention and you want some support, you want to optimize your wellness, that's when you can talk to somebody. But if you're feeling like these things are interfering with your life and you're not able to implement some of these tools that we've talked about, then definitely you want to go and speak with a professional.
I like the way you put it. If you're trying to bring in these prevention strategies and you need some help, because not everything is easy. It's easy for us to sit and talk about it, but putting into practice is hard, and you need some help to bring it into your lives more consistently. Or in other situations where your symptoms are more advanced and the body has suffered a lot, for sure. But also know that when you're trying to put these things, preventive measures into place, and you need a little extra help, Dr. Bhopal is there. Her area of expertise is mental health and sleep. And as an integrative medicine expert, rest of it is my area of expertise. And help, detailed help into, sometimes it's just not nutrition, exercise, movement, all of those things. Sometimes it's important for us to go through supplements that you may need. There are very safe herbal medications that can help with a lot of the symptoms without the risk of dependence, addiction, or any other adverse effects on the body. There are a lot of mind body practices that we can put into place to help with anxiety, depression, stress, overwhelm, all of those things, like hypnosis, safe, easy practices. Then we can tap into other systems like, acupuncture, for different symptoms, or gentle tonification. So there are lots of resources available, and you don't have to wait till your symptoms get worse to reach out for help. I want to conclude this by, I, Dr. Bhopal and I are going to share one self care practice that is simple and easy to do. And I want to introduce that with this one concept. So we talked about a lot of things, but nature, reconnecting with nature there has been several studies and a lot of data that tell us that nature, we are all suffering from nature deficiency disorder. We don't go outside and expose ourselves to nature enough. Open sunshine, plants, green, and that this we are now finding out that this has a profound adverse consequence on our mental health and also physical health. So the self-care practice that I want to share is that I started growing house plants, and sometimes when I'm really busy to go out, or I don't even, sometimes I'm so busy that I don't even have time to step out to few minutes into my garden. So in those times, I just pick up a cup of coffee, or no coffee. As soon as I come back from work, I will just put a chair next to my house plant and sit there for a few minutes. you know it's just the plant and me. I've grew that plant has been with me from when it was small, so it's like a living thing for me. It's symbolically, I bought the plant when my kids went off college, so it's very symbolic, and I've seen the plant grow. So it's when I sit near the plant, all those feelings and connection come into play, and then the leaves and the green and the oxygen. So I find it very refreshing and very easy to do, even if for me, even stepping out in the garden sometimes seems to be an extra effort, but I do this as a substitute. Dr. Bhopal, do you want to share what your favorite self-care practice is?
Yeah, I love that so much. And again, I think, it makes it easy because, when we think about going to spend time in nature, it doesn't mean you have to go now drive to the mountains and go stay in a cabin for a week or anything like that. Like you can simply just sit with your houseplants in your home and it can have a positive impact. So for me, mine is, well, it's kind of like there's two parts to it. It's taking a digital detox, at least one, at least half a day a week. So what I mean by that is just being off the phone, off the computer, just putting all devices aside, no TV, no screens, and sitting outside in the sunshine. And I love to do that. I just find that so energizing. And again, especially if you're inside a lot of the day, if you're working indoors, many of us have a deficiency of light exposure during the day. So I love to just sit outside on my deck. It's nice and sunny in the morning where I live, and just sit out there, no screens, have a glass of water, and just enjoy. And it's really beautiful because there's trees and things, and so it kind of connects with nature as well, like you were saying. But yeah, that's one thing I love to do is digital detox and just being outdoors without any distractions.
Absolutely. The wonderful practice is, again, easy to do, right? I mean, no special preparation needed. It's all the mindset and the will to do it. So, in interest of everyone's time, you know, I want to conclude our discussion here. I'm just going to check for a minute if there are any comments. I don't see any comments here. So thank you all for joining us. And for those of you who are watching the recording, thank you for doing so. If you have any questions, you can always put it on the comment in the respective platforms that you're watching the recording. And Dr. Bhopal, it was wonderful talking with you, wonderful hearing your perspective and your expertise in this.
Oh, thank you so much for having me. And no, I really, really enjoyed this, and I learned so much from you, and really appreciate the work that you're doing in your practice.
Likewise, your integrative approach to mental health is very, very important in this day and age, because it's just not one thing that helps. It's a combination of incorporating all the things that are in our toolbox to help our patients. So thank you for that. And once again, we want to thank you all, for those of you who joined us.